It's not a contraindication to pregnancy, and unless a woman has demonstrated that they have no other causes of infertility, only then do we look to the fibroid as a possible cause.
I see. Now, if a woman comes in and she has fibroids and then they're removed, are there tests that you do for everyone to see if the fallopian tubes are clear? Or is that test just not necessarily done on a woman just because she has fibroids?
No, not necessarily just because she has fibroids.
Okay.
If a woman is having infertility issues, then part of the infertility workup would be to check to make sure that the tubes are open. So if we do find that the tubes are blocked, then we could look at the fibroids as a possible cause, but then there are other causes as well, so we don't necessarily automatically attribute that to her fibroids. It's just an individual basis.
And just a quick note, too, about infertility and problems with infertility, that the man, the husband or the boyfriend, also has to go through a number of tests in order to see whether or not if he is the problem.
Absolutely. 40% of the time it's something that's called male factor, which means that, you know, the male possibly may not have enough sperm, or he has sperm, but the sperm may not be swimming or motile, or they may not be normal sperm.
Mm-hmm.
So we don't want to put a woman through a huge infertility treatment, surgery, and all that, only to find out that her partner has no sperm. So definitely the man does need to take part in a workup for infertility.
Is it a misconception that once a woman has her fibroids removed, that she should quickly begin to try to have children?
We actually prefer for a woman to wait at least a year, because we like the scar on the uterus to have a chance to heal very well and the uterus to become strong again before it has to expand to accommodate a pregnancy. So ideally, a woman should wait at least a year to 18 months prior to having a pregnancy after fibroid surgery.
Mm-hmm.
And for the most part, most of the time it is necessary that she undergo a cesarean delivery, simply because she's had the uterus cut into, there's been incisions made in the muscle, and it makes you at higher risk for rupture of the uterus should you go into regular labor. So we do, if the muscle is actually cut into, recommend a cesarean. Sometimes fibroids actually are on the outside of the uterus, in which case you can have a normal vaginal delivery if those are removed.
Wow, a lot of interesting facts there. Let's take a look at Cassandra's recovery. Now that her surgery is over, just how is Cassandra making out? For the next few weeks, she won't be able to move much, and while she's not back to her normal self, she allowed us to come into her home to see how she was doing.
That's one. Okay, here's harmonic back. Let's take a look at that fiber. So here's a small fiber.
My sister called my parents and told them, well, she has 7 fibroids. I did not know until I was awakened and up in my room that I had 7 fibroids. I was in shock, but I told her, I said, I feel vindicated at least. And I know now that I was in pain for a reason. I always knew that I had more than 3. In the back of my mind, I always knew that it was something more going on, because I know my body, and I know that this pain wasn't a play. I knew it was a serious situation. So I wasn't really surprised. I knew it was worse than what it was. I had a feeling. I asked the doctor first if I was going to be okay. I asked the doctor if I was going to have children. I asked the doctor if I was going to be able to be in the land of the living quickly. And she assured me yes to all of my questions. But my main concern was I going to be okay? She told me to start with liquids at first and then work my way back towards a normal everyday diet. I'm taking Percocet right now. The pain is pretty much stitches. It hurts to laugh a little. It hurts to cough. It's painful, but I'll accept the pain because it's going towards my recovery. But it's not excruciating right now. Day by day it gets better. I'm napping for the most part. 95% of the time right now, I'm napping. I'll be reading a lot, learning about my health, other issues that I have. Aside from fibroids, I do have high blood pressure. I want to become healthy. That was a promise that I made to myself. And being a young woman, I feel that health is important. We should be taking care of ourselves, and we shouldn't neglect our bodies. So getting in shape, talking with my trainer Laura, and getting back in the gym and getting myself fit and taking care of myself so I won't have these other issues, and preventing this from happening again if I can, because fibroids can grow back. I want to make sure that I take good care of myself.
She really gave some great information there for everybody who's listening. This surgery is like any other surgery in that you go under anesthesia.
Right.
We saw the video there. I am sure that emotionally it takes its toll on women. What do they tell you emotionally about the process of recovery or the process of just having fibroids in general?
Well, often the women come into surgery already feeling worn down, tired, just because of the anemia, dealing with the pain, the symptoms for years, and there is a tendency to sometimes become depressed after surgery or impatient with the recovery process. So that is something that we definitely watch out for.
And do women generally have, I guess, overwhelming problems where they need to get on antidepressants, or does it ever get to that level?
It does occasionally, but typically as the recovery process occurs and they're feeling better, especially when they have that first period and they see that the pain and the bleeding almost immediately is better, even with the surgical pain, then they feel better and things begin to look up for them.
For Cassandra, what were your orders? What are the doctor's orders when somebody is recovering in terms of diet? And I understand that in terms of going to the bathroom, that was very important for her to go through that process.
Well, for Cassandra, she pretty much was able to go home the next day. She could eat the next morning. We have her start out slow with just what she feels like eating. The narcotics that she's on for pain do tend to slow down bowel function, so just for her comfort, we encourage her to drink a lot of fluids, to take some stool softeners and things just to get the bowels back functioning again. So just for her comfort, because as the gas passes through the bowel, it can cause some discomfort.
And how long until she gets back to normal, as she says, in the land of the living?
Well, she will know that she had surgery probably for the next 2 to 3 months. She'll still feel it. But as far as general activity, she can be up and about within a week. Within 2 weeks, she'll be back to driving. Within 3 weeks, because of the laparoscopic procedure, she'll be able to go back to work, although she may want to extend that a little bit. Typically, if you have an open incision, it's 6 weeks to 8 weeks before you're ready to go back to work.
And I want to make sure people understand your terms. By the laparoscopic procedure, you mean that little instrument that goes into the body to see exactly what's going on in there.
Right. That's the what they call the keyhole surgery, or surgery through the tiny incisions.
Now, what is the likelihood, I guess with anyone, including Cassandra, that the fibroids will grow back? I have heard stories of fibroids growing back immediately.
Yeah. Well, often when you hear about fibroids growing back, they're tiny little what we call seedling fibroids that were already present, but they're just not visible to the naked eye or visible by ultrasound, that continue to grow after the procedure. So it's usually not the same fibroid that actually grows back. It's usually another fibroid in a different location that has already begun, that enlarges.
Because some fibroids are a wait-and-see proposition.
Right, exactly. If a fibroid is not rapidly growing or enlarging, if you're not having severe symptoms with the periods, if you're not having severe bleeding or anemia, it's absolutely perfectly acceptable. In the majority of our fibroid patients, we do just watchful waiting. Symptoms tend to disappear after menopause. If the bleeding's not too excessive, often it's controlled by birth control pills or hormonal methods. If the fibroids are small and bleeding is your main issue, there's another procedure that we can do where we actually cook the lining of the uterus using superheated water in a balloon or a microwave, and this will actually treat the abnormal bleeding without actually having to do surgery on the fibroid. So this is another option for women that are finished with childbearing.
Wow. Now, when you reach menopause, when a woman reaches menopause, does that decrease her likelihood of having fibroids?
Absolutely. Fibroids are fed by estrogen. The estrogen is what causes them to grow. So when a woman goes through menopause, the fibroids do shrink, they degenerate, they become inactive, and they tend to become asymptomatic. So we rarely will do surgery on a woman that's postmenopausal for fibroids, because you just wait long enough and the symptoms will abate on their own.
And I don't want to scare anyone, but can a fibroid actually kill you?
It is possible. it is possible that fibroids can grow so large that they outgrow their blood supply and they actually start to degenerate and die. When the fibroid degenerates and dies, it can sometimes rupture, and yes, that can be fatal, rapidly fatal, because of blood loss.
So it's really, really important for people to get out there and get checked.
Right. So if you have very large fibroids, they need to be treated. As
we go to our close, I want to make sure that people understand what it is like to go to the doctor and get checked for fibroids. What is that procedure like, the checking?
It's just a routine pelvic exam.
Okay.
Just a regular pelvic exam. And we many times can feel fibroids on exam if they're in the particular location or size. Many times we cannot. If we suspect fibroids by a patient's symptoms and we cannot feel anything, then we order an ultrasound. And the ultrasound is a very simple procedure, painless. It can be done through the abdomen, where they just put a probe on the abdomen and use sound waves to look, or a probe is placed in the vagina using sound waves to look, again painless.
All right, so very simple procedure, kind of like just going to a regular exam.
Right.
I want to thank you so much. Your information has been so very helpful. It was great having you on as a guest today. Thank you for watching today's show. We hope that you, like Cassandra, will pay attention to what your body is telling you. And thanks to Dr. Andrea Price for her insight. And of course, extra special thanks to Cassandra Williams, who led our cameras into her life and shared her story in hopes that she might help someone in their own journey. For more information about fibroids, Dr. Andrea Price, and Cassandra's story, log on to www.njn.net and click on to Another View. For Another View of Your World, I'm Candace Kelly.